Hello, my name is Dr. Sushmita, and I am here to give my feedback on the 6-month Aesthetic Surgery Fellowship under Dr. Karthik Ram sir. So, this fellowship was not only an idea into the world of aesthetic plastic surgery, but it also gave me a holistic approach of the patient management, the ethical considerations, the surgery itself, as well as the various nuances of private practice. The core of this fellowship was the surgery itself. We had a lot of exposure to various surgical procedures and to various aspects of aesthetic plastic surgery. I gained mastery in certain plastic surgery procedures such as gynecomastia, breast augmentation, breast reduction surgeries, certain facial procedures, rhinoplasty, and many other procedures. We also had exposure to various procedures such as fillers, Botox, and other non surgical procedures such as lasers, etc. I learned to work with precision, efficiency, and a major focus on safety also. The second aspect that we learn is a comprehensive management of the patient. We learn to preoperatively evaluate the patient and also counsel the patient extensively. We also learned how to filter the patient based upon their psychological requirements as well as rule out patients having body dysmorphic disorders. We were able to interpret the patient goals, their ideas, and also educate the patient appropriately. Postoperatively, sir also helped us to manage the patient and also help us to do the postoperative dressings, various management protocols from how to applying plasters to how to counsel the patient regarding the various aspects of postoperative management, etc. So it gives us a very good idea what complications to expect, how to manage the various complications, the various scar reduction principles. All these was taught to us in a lot of detail. Sir also helped us to manage the ethical dilemma in aesthetic plastic surgery. It is not only about establishing a trust and rapport with the patient. My mentorship taught me that a great aesthetic surgeon is not only about refining technical skills, but also to assess the patient psychologically and also counsel the patient appropriately. Other than the technical aspect of surgery and ethical management, we were also taught about what are the various financial logistics behind establishing a private practice. We were also taught about various things such as the backhand team, how the team efficiently manages the patient, what are the various expenses which might be incurred while opening a private practice, etc. We were also introduced to the practice of ethical marketing, about how to bring about patients and how to efficiently market our practice to the general public. In conclusion, the 6 months fellowship not only helped me refine my technical skills, but it also gave me a holistic idea about what it takes to open an aesthetic private practice.